Hello, 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 everybody. This is Mother Stallworth on Ask Mother. And do we have a treat for you tonight? I have, not only is she phenomenal, but she's also a friend of mine. And Lori's going to introduce this great woman to you, highly competent. Okay.
Well, I am introducing Dr. Martha A. Dawson. Dr. Dawson was installed as the 13th president of the National Black Nurses Association, Incorporated, and represents the voices of 300,000 African American nurses of
Yay.
different races and ethnicities.
Yay.
In 1976, she earned a bachelor's degree, and in 1984, she earned her master's degree and completed her hospital residency. In 2010, she earned her Doctor of Nursing practice from Case Western Reserve University, Francis Payne Bolton School of Nursing. She served in senior level positions such as Vice President of Clinical Operations and Chief Nursing Officers. She managed her own healthcare consultant business. In 2019, Dr. Dawson was inducted into the Alabama Nursing Hall of Fame.
Yay.
She is a scholar in the Sparkman Global Health Center in UAB, and she's a UAB fellow in the American College of Healthcare Executives. We are so excited to have you here, Dr. Dawson. Welcome to Ask Mother.
Thank you so much. It's exciting to join you this evening.
I'm so glad. Um, I wanted to just say also that she was a contributing author to the Drive-Thru Flu Shots, a model that for mass immunization. And so she was a part of the drive-in, first drive-through flu shot model in the United States. As I said, a very competent woman who's just loves the Lord, and she loves the people of the Lord, and she is interested in our health. And we have her on tonight because of the COVID-19 vaccine and the coronavirus. I just put it like that, vaccine. And there are so many questions, especially in our community. And we thought, who better to ask than Dr. Dawson. You may have caught her on MSNBC and on some of the town hall meetings, but we have her here on Ask Mother. Ah, what a friend. And if I tell you she's a busy lady, she is. But welcome, Dr. Dawson. And you have made yourself an expert. You're an educator when it comes to this vaccine. And I want you to share with us, and we've got questions here that have been sent from different places, and we want you to share with us your ideas and your thoughts and your facts and your scientific facts regarding this vaccine. Well, these vaccines, because now we have several out. Okay, so welcome.
Thank you
And we
again. Great to be
we're
here.
glad to have you. Yes. So I'll just jump right on in. We've had quite a few questions. And one is, if you're not coughing or sneezing, can you still spread the coronavirus?
You know, at this time, since this virus is so new, I still try to encourage people that if you've had the virus itself, it takes you about, 14 days to recover. At that time, we do say that you're no longer contagious. However, I would just say from a word of caution, if you feel sick, and you're still not feeling that well, I would say still isolate yourself for a couple of more days. And remember, just because you've had the coronavirus doesn't mean you can't catch it a second time, because we do have documentation where people have contacted us a second time. And we
Wow.
have to remember, when I wear my mask, I'm protecting you. If
Okay.
you don't wear a mask, you are exposing me. That's why we both need to have the mask on. So
Right.
even though you may not be contagious anymore, you still want to practice these three things: washing your hands, staying socially distant from people 6 feet apart, and still wearing your mask.
Okay, so just because you may or may not be sneezing or coughing, you still may be contagious.
Exactly. And that's again why it's spreading. Now, remember, when you first contact this virus, you can go for up to 5 to 7 days without symptoms.
Mhm.
But during that 5 to 7 days, you can still infect someone else. Then your symptoms begin to appear.
Okay.
Most people do not have symptoms as soon as they contact the virus, and that's why the spread is so bad.
Okay, so if you're not coughing and you're not sneezing, and you may have a low-grade temp, then you would still be, or even if you don't have a low-grade temp, but you may be infected and not showing any signs, are you contagious? Is that what you're
Yes, it
saying? You
does
still
mean that you can spread it to someone else,
Oh,
even though
okay.
you're not showing any signs at this time. Your temperature hasn't started going up, you're not coughing, you don't feel bad.
Mhm.
And again, like I was saying, that's why with this particular virus, it
Got to
is
wear your
so easy
mask.
for you to be infecting others, and you don't even know it because you're feeling well,
Mhm.
but that virus is already residing within your cells.
Mhm. And just talking, you can be sending out infection, just talking.
Yes, because when we talk, whether we know it or not, and we don't see it, and normally we don't pay attention to it, but it's so easy for those droplets to be out there in the air. And that's
Mhm.
why we say stay 6 feet apart, because
Mhm.
by the time your droplets travel that far, you're not going to get on the next person. But when I'm right in your face, if
Yep.
I'm talking the way I'm talking now, and
Mhm.
I'm probably sending out droplets the same as
Mhm.
you.
Okay, all right. Lori, you got another
Mhm.
question?
In the National Black Nurses Association's experience, how do many in the Black community feel about the COVID vaccine?
I've had a lot of discussion about the COVID vaccine and
Mhm.
how the African Americans and Black communities are really feeling about this. And out of transparency, there's two things that are driving this conversation. And a lot of it is in the media. But we do have to look back historically and
Mhm.
say, why are people asking questions and feeling a little bit distrusting of the scientific evidence at this time? So we go back to the Tuskegee incident.
Oh,
Mhm.
yes.
The fact that that went on for so many years.
Right.
Yes.
And this involved African American men in Tuskegee that was told they was in a syphilis study.
Mhm.
And yet
Yes.
still, when they finally, developed the treatment for syphilis, it was withheld from those men.
Right.
Mhm.
Mhm.
Now, you listen to some people and they may want to say, well, you just need to get over it.
Mm.
No, we can't get over it because the last person in that study that died passed in 2004,
Mm.
like just right around the door. And
Mhm.
the other thing with that is that because these men were uninformed, that meant they infected their family members,
Right.
Wow.
neighbors, some of their
Mhm.
kids probably was born with this syphilis. So we acknowledge that a big mistake made by our own government.
Mhm.
Second case that a lot of people have heard about is Henrietta Lack,
Yes.
case out of Johns Hopkins,
Mhm.
where this African American female was treated for cancer.
Right.
And although she did not survive, what they determined was that her cell multiplied so quickly.
Yes.
And it allowed them to invent a lot of other, I would say,
Treatments.
treatment modalities
Mhm.
for other cancer patients. And so her family didn't find out about this until about 5 or 6 years ago.
Right.
Okay.
They didn't tell them.
When someone decided to write a book about it.
Mhm.
And so that made people a little bit distrusting. And there are other examples as well.
Mhm.
when women that was in slavery,
Mhm.
given a lot of experimental surgical treatment
Mhm.
relating to OBGYN without
Mhm.
pain medication. So we
Mhm.
have that history. We
Wow.
try to move the needle a little bit, however, and say, could those things happen today? Probably, but it would be on a very small scale because the new rules and regulations that are put out there relating to research and
Mhm.
research participants. So yes, that is out there, but my goal is to use what I'm calling a model that hopefully through education, we will
Mhm.
move people from hesitancy to readiness to have be clearly informed and receive education to acceptance of that information to action because
Okay.
we have to move to action.
Okay. Yeah, thank you for that. And I also agree that we do have to, we don't throw away our history. We have to keep our hand on the historical button. Um, and for another reason is that that will help us to gauge where we are, give us things that we can look for and look at and give us pause to say, oh, no, no, don't do it that way, do it this way. So you're right. Um, we do need to keep in our minds a lot of the historical things that have been done in a disproportionately negative way toward us as a people. But we do have to keep moving forward. The whole point of these vaccines is to get rid of the pandemic. And we can just remember that because the kill rate of this virus is very high. And now we're looking at over 425,000 deaths. And I heard, I think it was Dr. Fauci or someone said that they're expecting within the next month, 90,000 more.
Wow.
That's ridiculous.
Mhm. Yeah,
So,
I mean, we have to do something because right now, about 1 in 5 to 6 people that contact this virus, they're dying from it.
mhm,
And the next thing is just recently, in terms of looking at some of the data and the death rates, um, COVID is now the third leading cause of death amongst African Americans and Blacks.
Mm.
The third leading cause,
wow,
okay, of everything else that we're dying from. And remember, it's only been here for about a year and
right.
it's killing us at a disproportionate rate. So, and we cannot treat it. And that's the thing that I keep wanting people to understand. We do not have a treatment for COVID. All we
Wow.
can do is treat the symptoms of COVID. And
Mhm,
hopefully that once you get it, you can you can move towards being asymptomatic.
mhm,
Because I even like to be careful that we're not talking about recovery because I'm hearing too many what we're calling long haul effects as we
right.
move now
Wow.
further into this, where people are breaking out with rash. They are being extremely tired and sleepy.
Mhm,
Their hair is falling out. You
mhm,
know, they're complaining about the fact that their memory doesn't seem to be as clear and their thought processes are not as clear. So for something only been around for about 12 months, we don't know the full effects until we continue to move forward. So we need to prevent. We need to prevent people from catching it. And unfortunately, the only way we can do that is through a vaccine. So we're
mhm.
talking about prevention here, prevention of you catching it and stopping the spread of it.
Okay. So if they can't measure the healing process, then how can they measure the vaccine's side effects or the effectiveness of it?
Again, we're not talking about healing. We're talking about prevention. Okay,
Mhm,
and we're talking about trying to manage it. So let me just
okay,
use a couple of common examples. So for example, I had the flu shot already this year.
mhm,
Now, I could still potentially catch the flu, even though I had the flu shot.
right.
But the goal is that since I had the flu vaccine, that it will not be as worse. And I do
Mhm,
want people to hear this very clearly. People were dying from the flu.
right.
When we did the drive-through flu process at the University of Louisville, that was during an epidemic.
Mhm.
Now, an epidemic is different from a pandemic because an epidemic primarily means it is just maybe countrywide. This is a
Mhm.
pandemic because it's right now, it's on every continent in the world. I
Right.
don't care where you go, it's there.
Mm.
But what we learned out of that is that if we could vaccinate enough of people, fewer people would catch the flu, which means fewer people would die from it. And the other thing is that if I use another example that I've used in the past, is that if you have high blood pressure and I give you a pill, I didn't heal you,
Right.
but
Right.
I did lower your blood pressure so you don't have a stroke.
Right.
Okay.
Mhm.
And if I replace your knee, I
Mhm.
didn't heal your knee, but
Mhm.
I did maintain your mobility and your freedom to walk. So
Mhm.
that's how we have to look at this. We're
Okay.
trying to prevent you from catching this and dying from it because we don't know
Right.
who is going to die from it.
Those are very good examples that I think that all of us can grasp. But Dr. Dawson, how long does the antibodies last after you've had the COVID? Do you know how long it lasts?
Okay, again, we can't say because guess what? We just started giving this out in December.
Mm-hmm.
But according to what they were looking at when they were in the lab developing this,
Mm-hmm.
that's why they give you one. That's why they were saying you have to take 2 doses. The
Mm-hmm.
first dose is like your boost dose, okay, and then you come back in about 3 weeks and they reload your system.
Mm-hmm.
Been trying to strengthen that immune system. So
Okay.
what really happened when we say we're giving you a vaccine, such as the COVID vaccine?
Mm-hmm.
First of all, we're not giving you the real live virus because we
Right.
heard that out there. Well, you're
Right.
going to be putting the COVID into my system. No,
Mm-hmm.
no, 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 no. This virus needs a cell to live in. And the fact that we have created this synthetic, vaccine that has to be frozen. Trust me, even if a virus was in it, it's dead because we frozen it. Okay.
Mm-hmm.
Okay.
Mm-hmm.
So we give you the vaccine so that your system, your immune system, will begin to fight it.
Okay.
Because that's the way our immune system responds anyway. Anytime something that is unfamiliar enter our body, immediately it's kind of like that flight and fight syndrome. It
Mm-hmm.
comes up to try to ward that off. So if we
Okay.
start giving you that, it begin to work in your system. We give you another shot and it's working. So hopefully then if you come in contact with me and I have the virus, and even if the virus enter your body, it's gonna go, your system is gonna be saying, I've seen this thing before and I'm about to fight it. I'm
Mm-hmm.
gonna
Uh-huh.
from coming in and take it over.
Mm-hmm.
Because what happened with the coronavirus, once it get into your cell, it start multiplying and taking off.
Yeah.
Because what it's looking for is a live organism that it can multiply itself into. And so when you've already had that shot, then it recognizes, no, this is that same thing I don't want, and your system began to fight it.
Okay. That's wonderful. It's amazing our bodies, isn't it?
Yes.
Lori.
Um, there's a question about what was the National Black Nurses Association's initial thoughts and concerns about the vaccine when first hearing about it? And how have those thoughts changed over time and why?
Okay, the National Black Nursing Association, I've been a proud member now since 1990. Never envisioned that God would allow me to elevate up to the presidency.
Yeah.
But it also just remind me of that statement, but who knows, God might have just put me here for such a time as this.
Right.
Yes.
Right.
And
Right.
so speaking from that standpoint, I was, first of all, I want to say the National Black Nursing Association been around for 50 years.
Oh, okay.
We've been out in the community educating people prior to COVID.
Mm-hmm.
So a lot of community already know about the National Black Nurses because we've been out there taking blood pressure. We are on the nursing guilds at the churches. So we've been out there working and doing things and educating.
Okay.
So when this first started coming out, I tell you, we was on it. we've had members that actually participated in the
Mhm.
clinical trial of developing the vaccine.
Okay.
I've had members that was actually on the task force where Health and Human Services contacted us and said, we need someone from your organization to represent us. And I selected two of my very fine individuals. One was already working in what we call vaccinology. Now, people probably didn't even know that was a science out there called vaccinology. But these people that have been out there doing these vaccines and working this in that space of healthcare, that's what we call a vaccinologist and vaccinology. And so
Okay.
this lady, she has been out there working with the homeless population every year to make sure they get their shingle shot, the flu shot, you know, and whatever else that they needed. They were making sure of that. So we had confidence in the fact that we started focusing on them developing this vaccine, the science of how they was going to do it. I actually had the opportunity to interview one of the scientists from Pfizer,
Okay.
you know,
Wow.
asking questions. And those were some very critical questions because I was saying, okay, this is what my people want to know. Why should they trust you?
Mm-hmm.
Why is it being developed so fast? So I was educating myself, and also my nurses that was on that vaccine task force, they were getting educated. So
Okay.
and I'm I've already signed up for mine now. They finally told me my term is coming around at my university so I can get it. And I've had other nurses that have already taken it. And I will tell you, this is a personal testimony here. In the last 2 weeks, I've lost two of my nurses' husbands to COVID,
Wow.
Wow.
and both of them had. Luckily, a third one, her and her husband recovered. One just texted me early this morning saying, and she just sent me her little statement that said negative.
Thank you, Jesus.
We are nurses. We're out here on the forefront. We're fighting for our lives. We're fighting for yours. But if you want someone here tomorrow to take care of you, you have to help us to survive this
Right.
because the nurses are coming down with this disease. Some of them are carrying it home, and it's heartbreaking to see people who are out there helping someone else.
Mm-hmm.
You know, there was one nurse who, when one of his colleagues got COVID and they needed someone to work, he said, I would go into work. He went into work. Within 7 days, he caught COVID. Within about 20 days, he was dead.
Oh,
Oh,
We don't want those kind of stories.
no.
You know, there comes a time when we got to have enough of faith to believe that God can give people the intellect to do some good things.
Mm-hmm.
And remember that when Jesus selected his disciples, he had a physician on that team.
Mm-hmm. Yeah, he did.
yes, he did.
Luke, you're right. Um, thank you so much. That was very interesting, heartbreaking too. Um, but now here's another question. If you've had COVID this summer, can you take the vaccine now?
Yes, you can take the vaccine. You
Mhm.
know, if you've already had it and you no longer having symptoms, it's okay for you to take the vaccine. And again, we are encouraging those people to take the vaccine because, as I said, we got two things going on. Well, we know some people have had COVID twice already. They
Mm,
had it once and then they caught it again.
mm,
And now we're hearing about there are three different strains of this virus that is now in 26 states in the
yeah.
United
Mm.
States.
Mm,
And what happened when viruses like this keep multiplying, they get stronger with each evolution of
yeah.
that virus.
Mm.
Yeah.
And so now we've gone from just the coronavirus to a stronger strain to another stronger one, now to a third one. And I want you
Mhm.
all to understand also that the coronavirus is kin to what we used to call the SARS and
Yeah.
also MERS.
Oh,
So,
wow.
so again, all of these are within the same family of coronas.
Okay.
Wow.
Well, if someone has COVID and quarantined for 14 days, are they still contagious when they go back to work?
Not if they don't have a temperature and they're measuring everything else, they shouldn't still be contagious. With 14 days is kind of like on the outside of what we're saying. You should be okay by that time if you're no longer having any symptoms, you know. And when we say any symptoms, that means like a high fever and stuff like that, because like I just said, a lot of people are saying they still feel tired. You know, I've had people that have had COVID and they go back to work, they said, I'm doing fine, but when I go home, all I want to do is hit the bed and lay down and sleep to the next morning. Because this does take something out of your system.
Yeah.
Dr. Dawson, I have a question.
Speaker.
Since there are 3 strands of the virus, like you was just mentioning, is the vaccine prepared to tackle those other strands?
They're testing that now. And I know Johnson is also trying to develop something very specific for those stronger strands at this time. Okay. So again, we have to stay in the lab. We have to continue to develop, continue to monitor, and continue to work. So this is almost like a round the clock, you know, job for these scientists. You know, that they can't just, when something comes up, they got to say, okay, now we need to test that. But until the first person get it, they don't have a way to test it. So now they're looking at those individuals that have caught these stronger, you know, mutations of the virus.
Okay.
Wow.
Here's another question. Most of my coworkers had the virus back in the spring. Can they get the virus again? Well, you already answered that. Well, then should children wear masks at all times when they're out from the ages of 12 and down?
Yeah, what I would say, and again, this is what I'm going to advise you, is if you got a 12-year-old that is pretty healthy, large size, you know, I mean, I got some little cousins and nephews that are 12, they're about my size. So yes, they need to have a mask on. It's not going to bother them. The reason we say don't put masks on kids is because it makes them very uncomfortable. They can get very agitated with it. And also when you're talking about a 3 and 4-year-old, they're going to be putting their hands on this, pulling off, touching stuff and fooling with. So we don't want them to automatically transfer things. So for the younger kids, we say no. But the thing that I would say most importantly to parents at this time, if you have any way of protecting your children and they don't have to go out, let them play close to your own yard, but don't send them out if you don't have to. And please, it disturbs me so much when I go to these big box stores such as Sam's and other places. And I see these kids just running around, touching everything down on the floor, you know, and the next thing you know, they're putting their hands in them. Parents, love your kids.
Right.
Hear me very carefully. I didn't say take care of your kids. I said love your kids.
Yeah.
Because now, you know, although we were saying that children wasn't catching it that much, that fast compared to the older adults, there are over 2.5 million children now with this disease. And many of them are ending back in the hospital needing to have, having cardiovascular issues, you know, having problems with their lungs. And so the thing we want to do is prevent them from catching it, because we're going to be learning about this virus the rest of our life.
Yeah.
Okay. Because everyone who have caught this virus now has a pre-existing medical condition.
Right.
And
yeah.
so that's how come the word is prevention. And I would tell you that my school allowed me, because I was primarily teaching online anyway, that I did not have to come to campus. I can, you know, work from home. I've been working from home since March. And I probably have been in that in my school building maybe 3 or 4 times. And I promise you, I'm trying to be obedient, because just because I'm working at home doesn't give me the right to go running into the mall, running to the store every day.
Right.
So I am practicing what I am preaching and teaching.
Yes.
And that is, I try to remain and stay at home, and I do my own self-tracing. If I leave the house, I want to know, where did I go? And early on during this pandemic, I would go out, I wait 14 days before I would go back out, because I'm saying, okay, I've had no symptoms, I'm doing fine. So if I go out and I become symptomatic, I would know. Don't go back beyond 14 days because you were fine. Where did you go when you went out? And I try to limit it to no more 3 or 4 places, and that's it.
Yeah.
So, you know, we have to do the right thing. If we want to be here tomorrow, we have to do the right, and even doing the right thing, we can see
Right,
It's not separate to me, because if I do the right thing and you do the wrong thing, you can still give it to me.
right, right, right. Do you have any more questions? I have one more question. If you've had COVID, should you still take the vaccine? I think you already answered that. That,
Mhm.
yeah,
Mhm.
yes,
Yeah,
you answered yes to that. Do you have any more questions? Go ahead.
Okay, that's okay.
All right. What we're trying to do, Martha, with this airing, we want to make sure that we get it out to as many people as we can to dispel a lot of the myths and then to just get them to understand. I think the word that you said, that we are striving to prevent further infections and deaths. That's what this vaccine is designed to do, prevent. And this I think is important. And yes, I read some just the other day. Some of that there are some side effects, like you said. Some people do experience some things, but they are alive, and and those things are not debilitating. So it's important. Laura, you got one more?
Yeah, that does lead into this one. It says, does the National Black Nurses Association believe that this vaccine can truly help people? Why or why not?
I have to say yes. Again, and our reason is because we've been working with. We did not just start working with Johnson and Johnson and Pfizer and AstraZeneca and some of those other pharmaceutical companies. We were already working with some of these companies just around the shingle vaccine, the pneumococcus vaccine for pneumonia, and the flu vaccine. So again, we was already in that space of working with vaccine and educating the public, and even encouraging people to go ahead and help their children to stay up with all of their immunization, because that is important. For example, a lot of people are not aware of the fact that the shingles really is caused from the measles. So if you had the measles when you was a young child, when you hit 50 and you get the shingles, you are more prone to end up with the shingles because of that. So that's why, again, we learn about different things. That's like I was saying earlier, even with the coronavirus, we don't know what happened until we continue to live and figure out some of what could go wrong and what will be the impact of this. We don't know that until that's why the goal is not to catch it. And that's our.
Oh no.
They, if I never had it, they try to keep me from getting it. If
Right.
I get vaccinated and the vaccine works,
Internet
then that means I'm not, if I don't catch it, then I'm not gonna give it to you.
Yeah.
So we are in this together. And it's so important that we understand that the National Black Nursing Association, our goal is always to protect and to educate. Now, I'm not here to convince anyone to do anything. My goal again is to give you the information, because I also recognize there was so much misinformation given earlier around this vaccine. When the first case hit the United States in January 20th, 2020, someone should have jumped up and took action right then from the federal level, and it wasn't allowed. Then we had all this disinformation that was being put out there, politicizing this. Statements such as it's going to disappear by Easter, or it's going to have a miracle and it's just going to go poof. You can use Clorox and Lysol. And all of that disinformation was wrong, and we know that. And so we have been trying to combat the disinformation and the misinformation and say, here's the information. We've been as transparent as we can. No, can I promise you 100% it's going to prevent you from catching COVID? Like I said, no, I can't. Even though they've had people in clinical trial, when they said they had 95 to 97% efficacy.
Mhm.
That still meant somewhere between 3 to 5% of the people still caught the COVID after they had the vaccine.
Mhm.
But let's look at the odds.
Mm.
How many people that are dying? I just said 1 in 5 people that catch COVID are not living.
Mhm.
So would I prefer that you just go ahead and take the vaccine and have just a 3% chance that it may not protect me?
Mhm.
Opposed to
So
the.
that's what I want to
Right.
balance that. And
Mhm.
again, I would say, now, Mother, you know us. Yes, it's praying time, and it's been praying time. So we keep
Absolutely.
on praying as well. We ask God for mercy.
Yes.
We ask Him for His grace. But at the same time, I'm saying, but Lord, if there's something that I need to do that I got to rely on man, please
Mhm.
just protect me while I do it.
Yes.
Yes.
Actually, what I've said to the ladies, and well, just to the people, is that we have prayed and we have blessed it. We bless it and ask God to let it do us good and no harm at all. And so we believe that. The other thing that just came up in the news, that this new one shot um, that Johnson and Johnson is bringing forth, where you just take the shot, one shot, and don't have to have that second one. But they say that it's only 66% effective. That's what I just heard. I think it was day before yesterday. Do you have any comment to that?
I think again that this is something that they're trying because of the fact that they want to push out and try to get so many millions of people vaccinated early on. So again, the 66%, sound a little bit low, but again, if we're trying to get so many people vaccinated and trying to produce this medication at such a rate, that may be the case. But I also want people to remember something again, from an educational standpoint. I take the flu shot every year.
Mm-hmm.
It's not that I took it back in 2019 or in 2015 or 2005, and I haven't had to take it again.
Mm-hmm.
That's the
Right.
reason for that. When
Mm-hmm.
I've had shingles vaccine 3 times, because the first time that I took it, they were saying you only needed to take it and that would be it. Then they came out and said, no, there was a more effective way to do it. And that is you take a dose, wait 6 months, and you take the second one. And so, and I just went through that this year where I had my 2 shingle vaccine. Now, why did I take the shingle vaccine? Because I had the shingles 3 times prior to I got the vaccine.
Wow.
Mm.
And that shingles can be very painful,
I think I'm gonna go get
and very devastating to you. Now, I was lucky because I'm a nurse, and I knew when I woke up screaming in the middle of the night and I looked at my stomach, I thought, I've got shingles. Let me get to the doctors, get something. It happened to me again. And guess what activates shingles? A lot of stress.
Yes.
And
Wow.
it can be caused by work. It can be caused by your children, by your husband. It can be caused by this pandemic.
Mm-hmm.
Wow.
Mm-hmm.
Wow. Stress
So
related.
we just have to know certain things and feel that. And I don't want anybody to think I'm being flippity, but I just have to remind myself all the time, God's got this.
Mm-hmm.
Yes.
Got this. God got this.
Mm-hmm.
There's the good, the bad, and the ugly, but God got the good.
Yeah.
And
Yes.
we can cooperate to protect each other. I believe God will award our faithfulness.
Yes. Okay. One more question, and we're going to wrap it up. Do you, as far as the mask, now they're saying to wear a cloth mask under over the other mask. And then there are others that saying use the N95, that's the best one, the one with the beak. Personally, I like that one the best, the N95, because I can breathe better and I can talk better. But in your professional opinion, just your opinion.
I would just say, with my opinion, I've used both. Okay. I've used the cloth and I've used the N95. Basically, when I use the N95 is when I feel I'm going to be out in public around more people.
Mhm.
Okay. And so, and now I know some people are saying, well, you need to double mask, you know. And I haven't had anyone to prove the efficacy of that. And I know that Dr. Fauci had made some comments about it. But my thing is this, is just at least use something.
Mhm.
And again, if you don't have to be out, don't be out. You know, limit that just going out for the fun of it.
Right. Mhm.
I know some people say, I just can't stand to just be at home by myself. Pull up your computer and talk the same way we're talking now. I
Mhm.
feel like I'm just right in your living room. I see the lamps back there. I see the flower in the corner, looking at the pictures on the wall. Looking at your jewelry. So that's a way that we can make this work for us.
Yes, yes, yes.
Yeah.
And so, this is a good time to catch up on some reading, catch up on some
Mhm.
cleaning the house. Come on, people, we got work we can do. You know.
Plenty, plenty.
Oh,
So I
well,
would just say, at least protect yourself. And remember, you're also protecting your loved ones as you're protecting yourselves.
thank you so much, Dr. Dawson, for your just your transparency and your scientific knowledge, and just being willing to share with us. I appreciate you so much. And our Ask Mother audience they are going to be so much more able to make good decisions regarding this vaccine. Thank you again. God bless you. And we are so happy to have you as our friend and as someone who is so knowledgeable around this very, um, uh, what can I call it? The kind of, it's controversial, but necessary. It's controversial, but it is necessary topic. Thank you
Yeah.
again. God bless you.
Okay, thank you so much. Enjoyed it, and God bless you.
Okay, we'll see you again.
Okay, yes, we
God
will.
bless.